Thank you, Mr. Chair. The cruel impact of systemic racism is not only felt through law enforcement. Research, data, and lived experiences have made it unequivocal. Racial discrimination impacts immensely the health of racialized and Indigenous peoples. In some cases, it's an issue of life or death. Moreover, the intersection of gender and racism amplifies the consequences. For instance, the documented practice of forced sterilization of Indigenous women, undiagnosed endometriosis, in which symptoms are dismissed or ignored for years, far more often for women of color, the persistence of transphobia, and how the hospital is caring for our 2S LGBTQ+ community. The government made a commitment last fall to work to support studies that take diversity, race, and gender factors into account to improve women's health care. My question is to the Minister of Health. When will we see action on this commitment in an effort to eliminate racism and systemic barriers in the healthcare system?
The Honourable Minister.
Thank you, Mr. Speaker. Mr. Speaker, Mr. Chair, I appreciate the question and the importance of this conversation. This is work that our government started doing when we were elected in 2015, and we will continue to build upon that work. I agree with the member that there is more work to do, and that's exactly why I'm working with all departments, all agencies to make sure this work is happening. It's not just about public safety, it's also about health. It's also about equality and equity. It's about making better decisions informed by lived experiences. I can promise you we are not only listening, we are engaging, and we're committed to actions and outcomes. This government, with everyone's help, will get it done. Thank you, Mr. Speaker.